At Humana, when you tell us what you need and want, we hear you. And we offer plans that could help make your best health happen. To help you find the right plan for you, we'll begin with an overview of what Medicare is. Medicare is a health insurance program run by the federal government. It has 4 parts. Part A, which covers hospital stays. Part B, which covers medical needs like doctor visits. Part C, which combines Part A and B, plus it could give you other benefits. And finally, Part D, which covers most prescription drugs. Together, Part A and Part B are called Original Medicare. Step 1 is to first enroll in Original Medicare, offered by the federal government. Step 2 is to explore if you need additional coverage, and if enrolling in a plan through a private company makes sense. You have a few options here. You could choose a Part C plan. These are also called Medicare Advantage plans. A Medicare Advantage plan includes all the benefits and coverage of Original Medicare. Our Medicare Advantage plans give you extra benefits, and some even include Part D drug coverage. You could also choose to add one or both of these options to Original Medicare. A standalone prescription drug plan, also called a PDP, which gives you Part D coverage, or a Medicare Supplement insurance plan to help pay for any out-of-pocket costs you may have with Original Medicare. Now that you know what Medicare is, let's cover when you can enroll. You may have few opportunities throughout the year. The first is your initial enrollment period, or IEP. This date is a little different for everyone because it depends on when you turn 65. If you're enrolling in Medicare for the first time, you can enroll up to 3 months before and 3 months after your 65th birthday month. During this time, you may enroll in Part A, Part B, or both. You may also choose to enroll in Part C or Part D. Although you are not required to enroll in Part D, you could face a late enrollment penalty if you don't enroll when you first become eligible. This penalty will happen if you go 63 days or more without prescription drug coverage after you're eligible. You may pay an extra 1% of the average monthly premium for each month you delay enrollment. You can avoid the penalty with prescription drug coverage through Medicare, or you can avoid it with creditable prescription drug coverage that is expected to pay at least as much as Medicare's standard prescription drug coverage, such as an insurance plan from your employer or VA healthcare coverage. After your initial enrollment period, the next important enrollment period starts on October 15th. This kicks off the annual election period, or AEP. From October 15th to December 7th, you can enroll in a Medicare Advantage plan with or without prescription drug coverage, or you can enroll in a standalone prescription drug plan. Another enrollment period is available from January 1st through March 31st. This is called the Open Enrollment Period, or OEP. During this time, you can make a one-time change, like enrolling in a new Medicare Advantage plan or returning to Original Medicare. And finally, note that there are life events that may qualify you for a Special Enrollment Period, or SEP. These are times outside the other enrollment periods where someone can enroll in, drop, or change their plan, depending on their eligibility and the SEP. Now, we're going to explore one type of plan a little more closely: Medicare Advantage Health Maintenance Organization, or HMO, plans. Let's dive into exactly what an HMO plan is. On an HMO plan, you'll choose an in-network primary care physician, or PCP, from our large nationwide network to manage your care. Then, you'll need your PCP's referral to see a specialist in most cases. You generally need to stay in the network for services covered by your plan. Some HMO plans are Medicare Advantage only. They're Part C plans, meaning they combine Parts A and B coverage and have additional benefits, but they don't come with Part D prescription drug coverage. The Centers for Medicare and Medicaid Services prohibits adding a standalone prescription drug plan to a Medicare Advantage HMO plan, even if it doesn't include prescription drug coverage, so consider your needs as you choose a plan. You could also choose a Medicare Advantage prescription drug, or MAPD, HMO plan. MAPD plans combine Part A, B, C, and D into one plan, giving you prescription drug coverage alongside additional benefits. Every Humana Medicare Advantage plan offers extra benefits and services. For example, you could get in-home health care. A doctor or healthcare provider can help with treatment, diagnose issues, prescribe medicine, and more, all from the comfort of your home. That way, you don't have to wait in a waiting room or extend an expensive hospital stay, but you still get the personalized care of any other doctor visit. Plus, our network includes many virtual care providers. Virtual care, or telehealth, is a simple, convenient way to visit with a doctor for non-emergency illnesses or injuries, prescription refills, or wellness checkups. You can talk to your sales agent about services available in your market. Another benefit of our Medicare Advantage plans is the yearly limit on out-of-pocket costs for medical services. For 2024, in most cases, the maximum out-of-pocket limit for in-network services can be no more than $8,850. So, if you reach that amount in out-of-pocket costs, you'd pay nothing for covered services for the rest of the plan year. As a member, you'll be able to access Humana's simple Find a Doctor tool to search for healthcare providers in your area. In select geographies and specialties, care highlight ratings may be available. The clinical quality and cost efficiency ratings are indicated with hearts and badges. Along with other considerations, these ratings are meant to help you make the best choice for your specific needs. If you're considering a plan that includes prescription drug coverage, there are a few important things to know. First, most of these plans have a coverage gap. It's a time when you pay part of your drug costs before additional prescription drug coverage kicks in. If you think you may need help paying for your prescriptions, ask your sales agent about Extra Help or the Low Income Subsidy Program. It's a government program to help people who qualify pay for their prescription drug costs. It's also good to know that some prescriptions require step therapy. It means that even if a medication you take is included on your plan's drug list, you may need to try certain drugs first before moving to a more expensive drug. And lastly, prior authorization. It's a type of approval your doctor is required to get from your plan so they can prescribe certain medicines. As you get ready to enroll, your sales agent will go over a few important documents. For example, they'll review the drug list for your plan's summary of benefits, and information on star ratings. Those are ratings from the Centers for Medicare and Medicaid Services, which evaluates certain Medicare plans based on real members' experiences. Let your agent know if you'd like more information. If you sign up for a Humana plan, we'll send your ID card in the mail. You can choose to receive other plan documents online through a secure digital account at MyHumana. All you'll have to do is share your email address, which authorizes us to digitally share health information with you. Just be sure to let us know if your email address changes so we can ensure you get the information you need. You'll complete a health risk assessment by phone or online if you've chosen our online option. This is to see if you qualify for any special health programs. And be sure to attend a member orientation. Humana believes better care begins with listening. That's why your licensed sales agent is here to get to know you, your healthcare needs, your current medications, your health goals, and more. They'll review the plan's provider and pharmacy network, as well as plan premiums, cost for prescription coverage, and benefits. Most of all, your agent is here to help you find the right plan for you. At Humana, we'll keep bringing you the care you need and want, because if it matters to you, it matters to us.